Hey folks, this is Dr. Eric Fields, a psychologist specializing in gambling addiction. For any given addiction, there is almost always an underlying primary cause that drives this kind of behavior. And I will also add that it is very commonly the rule rather than the exception that there are multiple determinants of this kind of behavior, that there are more than one function to this behavior. But in my vast experience working in the addiction field, I have found that there tends to be one function or primary cause that stands out or drives this behavior more than any other one. A lot of times, addictions are used to distract people, and gambling addiction is one of the greatest distractors that I can think of. When we're looking at all the different kinds of addiction, I don't think any addiction does a better job at distracting people than compulsive gambling. That's one of the reasons why people who gamble compulsively have such a hard time learning to do it moderately, responsibly, and not recklessly. Because the whole reason why they want to gamble in a reckless manner is usually for emotional reasons, to deal with psychological issues. The psychological issue that I'm discussing today is trauma. A lot of people have difficulty admitting or acknowledging that they are bothered, to put it mildly, by traumatic experiences or events. And since gambling addiction afflicts so many men, this becomes a real problem because men, especially, have a lot of difficulty admitting that they are really vulnerable in this kind of way, that some event had such a significant impact on them, or series of events or experiences. It's very, very hard for anybody to admit that they're a victim, but even more so men. So, the reason why I'm discussing this today is because it's one of those hidden functions to gambling addiction. You know, the one that most people don't really recognize or repress, in layman's terms, selectively forget. And in a sense, this is kind of like a PSA, a public service announcement, to try to get more people who struggle with compulsive gambling to really thoughtfully and deeply think about the possibility of past trauma influencing this kind of behavior. In order for trauma to occur, or in order for somebody to have trauma, in my estimation, at least two conditions have to be present. Number one, there has to be some kind of traumatic event or events. And number two, the person has to have a certain vulnerability or sensitivity to these kinds of events. Now, some events are by nature so traumatic that almost anyone would have some level of trauma if they experienced them. You think of serious, serious kinds of events that could really invoke a fear response into people and have these persistent memories of the event. You can imagine all sorts of scenarios that would fall into that category. But I invite you to take a look at many other kinds of traumatic experiences that you may not think of as traumatic, which may help you deny the impact of these events or experiences. Some toxic romantic relationships can have a traumatic impact on someone. Certain experiences in the in their job can also have this kind of impact on them. Medical scares, you name it. The importance here is to not be so quick to dismiss that you have experienced trauma and that this is what is primarily behind the gambling addiction. Now, how do you know if you've experienced trauma? Well, as good as some people may be at repressing it or selectively forgetting it, if you take some time to think about your past without judgment and wait to see if any marked experiences with another individual, other people, in certain environments come to mind that were really negative for you. And so the kind of reaction that you would have to an event that's traumatic is one of great discomfort. Fear could be part of that discomfort or anxiety. They typically are. But what we're really focusing on here is just something that is really uncomfortable for you to revisit, reimagine, think about, et cetera, et cetera. A lot of traumatic events and experiences result in bothersome images, memories, and thoughts. And a lot of people that experience trauma will report that it feels like a broken tape player that just keeps going on and on and on, looping over and over again, the same track in a sense that just keeps repeating and repeating and repeating. These could be, again, images, memories, or various kinds of thoughts related to that traumatic experience. The good news here is that psychotherapy treatment is very effective at resolving trauma. As long as you're working with a therapist who's using evidence-based strategies, methods, practices, then there is a very good likelihood that the treatment will be effective and you will no longer be bothered by the trauma. How does this help your gambling addiction? Well, if you've seen my other videos or have some experience with my work, then you'll know my basic premise has always been that an addiction like gambling is more a symptom. And of course, that symptom can take on its own problematic nature and cause all sorts of other negative consequences, compounding the original issues. But gambling addiction is almost always a symptom of some issue that the person is trying to deal with. Sometimes they're trying to deal with conflict over whether or not to stay in a relationship or their job. Sometimes they're dealing with a heightened level of stress or anxiety. Sometimes they're dealing with some kind of depression where they are not feeling very fulfilled in their life. There's all sorts of functions that gambling addiction can address in the short term. That means it works to help the person with their issues, but only in the short term. And of course, it's a really unhealthy way of coping with your issues because it causes so many other problems. And just as importantly, the person doesn't get to actually work on the primary issue. Trauma can be one such issue. And this is a hidden issue, as I mentioned before, because so many people, especially men, don't want to acknowledge that another person or people have victimized them or made them feel really vulnerable, et cetera, that they've had this kind of impact on their life. And gambling addiction, being such a great distractor, is a great behavior for people to latch on to who don't want to deal with their trauma because it will distract you from those bothersome memories and thoughts and images. But as I stated before, this issue, trauma, can be treated very successfully. And what is more often the case is the trauma has to be treated first before you can really address the gambling addiction. And this is really interesting because if you look at the history of addiction treatment, it usually was the opposite, in that clinicians would want to treat the addiction problem or make sure the addiction problem was no longer present, make sure the person was abstinent for a period of time before they'd ever work on the primary issue, which in my mind is backwards. Many people are not going to be able to fully resolve their gambling addiction until they get their trauma resolved. Why? Because the gambling addiction is a person's security blanket. It's their way of coping with the trauma. They're not giving that up until the main primary issue is resolved. You wouldn't give up a way of coping until that stressor is no longer a main problem in your life. This is not to suggest that you can't work on both in therapy. Of course, I work on both in therapy. If a person presents with both trauma and gambling addiction, we are working on both issues at the same time. But what I'm proposing here is that the trauma has to be worked on. It's absolutely essential until you can make real progress with resolving the gambling addiction. This is Dr. Eric Fields, and I hope you found this video helpful in terms of being open to the possibility that traumatic experiences or events have plagued you so much so that you have now turned to this compulsive, distracting behavior as a way of dealing with this. I hope that you will be able to be open to the possibility that you may have experienced trauma.